Hey everyone, it's Dr. Anna Lafian, board certified rheumatologist. This month I have a student who's studying for her Step 2 board exam, and I decided it would be fun to do a series on doing rheumatology questions for everybody. All right, let's get started. This case says that there is a 24-year-old woman who comes to the office with a 4-week history of joint pain. What I normally do when doing board exams is I usually stop right here and look at what the question is asking. So the last sentence says, which of the following is the most likely diagnosis? And then let's continue reading for more information. She has a 4-week history of joint pain with moderate achy pain and swelling in multiple MCPs of both hands, with lesser pain in the wrists, knees, and elbows. She experienced intermittent fevers at the onset of her pain, but has been afebrile since then. She has had relief of her symptoms with over-the-counter ibuprofen, but in the weeks since she scheduled her appointment, she has not required medication, and the pain has resolved. The patient is married and has 2 young children. Vital signs are normal. Exam shows normal range of motion in all joints tested, with no redness, warmth, or swelling in any of the joints. X-rays of the hands are normal. Which of the following is the most likely diagnosis? All right, so let's start knocking these options out. A, crystalline arthritis. It can be knocked out because this patient does not have any signs of gout or pseudogout. That typically occurs in older males, especially as it pertains to board exam purposes. Fibromyalgia can be ruled out because the patient doesn't have any signs that they mentioned about any myofascial pain. They strictly were talking about joint pain. Gonococcal arthritis can be ruled out as well because they didn't mention any features of any sort of STD-like symptoms. Lyme disease can be ruled out because the patient did not travel to a Lyme endemic area, didn't mention any sort of skin or tick bites. Polymyalgia rheumatica can be ruled out because that usually happens in much older patients. No mention of bilateral shoulder or hip achiness. F, rheumatoid arthritis. Let's keep this one for now in the mix. G, spondyloarthropathy can be ruled out. There's no mention of back pain, inflammatory back issues, no history of psoriasis mentioned. H can be ruled out for lupus because there was no mention of fevers, oral ulcers, nasal ulcers, systemic symptoms of lupus. And I, viral arthritis. I think this is a really good option. Now F, let's go back to rheumatoid arthritis, can be ruled out because importantly, rheumatoid arthritis is usually diagnosed after 6 weeks of persistent joint pain and swelling. And here they mentioned that the patient experienced the pain for a few weeks. It was better with ibuprofen, and on exam today, there's no joint swelling at all, and x-rays are normal. So the answer here is viral arthritis. I hope you enjoyed this and learned something new. Please share this with any med students or residents that would benefit. Take care. Bye.